All right, today we're going to get to the bottom of a hidden health issue that affects millions of people, a lot of whom don't even know they have it. We're talking about gallstones. Let's dive in and figure out what's really going on in there. So, let me ask you this. What's a super common health problem that millions of us could be walking around with right this second and have absolutely no clue? Any guesses? You got it. Gallstones. These things can be silent passengers inside your body. But what in the world are they, really? Okay, so first things first, let's get to know the main players in this story. Understanding the basics is always the best place to start. So, meet your gallbladder. It's this small, kind of pear-shaped organ tucked right up under your liver. You can think of it as a little storage pouch for something called bile, which is this digestive juice that your liver makes to help you break down fatty foods. And gallstones? Well, they're exactly what happens when that bile hardens up and forms these little, or sometimes not so little, stone-like deposits. And, get this, their size can be wild. We're talking anything from as tiny as a grain of sand to, and I'm not kidding, as big as a golf ball. So, how does this even happen? Well, the best way to think about it is like a recipe. Your bile has a very specific chemical balance. And when the ingredients in that recipe get thrown off, you end up with an unwanted product: stones. Here's how it works, in plain English. In healthy, balanced bile, you've got these things called bile salts that are great at dissolving cholesterol, keeping everything liquid and flowing. But if your body produces way too much cholesterol, the bile salts just can't keep up. The extra cholesterol starts to form tiny crystals. Those crystals clump together and bam, that's how a gallstone is formed. It really all boils down to that imbalance. So what throws that delicate balance off? Well, there are a few key ingredients in this recipe. Your diet is a huge one, especially lots of unhealthy fats and not enough fiber. But it can also be things like your gallbladder just not emptying properly, certain hormones, obesity, or even losing weight too quickly, which can cause your liver to dump extra cholesterol into your system. And yeah, getting older and your own family history play a part too. So the big question is, how would you even know if this is going on inside of you? It really all comes down to listening to your body and knowing what signals to watch out for. You know, it's really important to understand that a lot of people have what are called silent stones. They just hang out in the gallbladder, causing zero problems. You might never even know they're there. The trouble really starts when a stone tries to make a move and gets stuck, causing a blockage. That's what we call a gallbladder attack, and it often kicks off right after eating a heavy or fatty meal. So, what does an attack feel like? Oh, you'll know. It's usually a sudden, sharp, and steady pain in the upper right part of your belly. And sometimes that pain can even shoot up to your right shoulder or back. Nausea and vomiting are really common too, along with just feeling bloated and gross. This isn't just some minor cramp. It can be incredibly painful and last for hours. Okay, I need you to pay really close attention to this next part. While that pain is a big deal, there are some other symptoms that are absolute red flags. If you see these, it could mean there's a serious complication and you need to get medical help, like right away. If you have that severe abdominal pain plus any of these other signs, like a fever and chills, or if you notice your skin or the whites of your eyes looking yellowish, which is called jaundice, or even dark urine or weirdly pale stools, that's a sign of a major problem, like a bad infection or a total blockage. Don't wait it out. So, let's say you've been diagnosed. What happens next? Let's walk through the different pathways to relief and what the treatment options look like. The way doctors approach this is actually very logical. If you have those silent stones with no symptoms, the plan is usually just to monitor things and maybe make some lifestyle changes. If you have some mild symptoms, the focus is on managing the pain and changing your diet. Yep, that means avoiding those fatty foods. But if you're having frequent, painful attacks, the most common and effective fix is surgery to just take the gallbladder out. Now, I know the word surgery can sound really intimidating, but a cholecystectomy, which is the name for the gallbladder removal, is actually one of the most common operations there is. And these days, the standard way to do it is laparoscopically. That just means it's minimally invasive with a few small incisions, which for you means a much, much faster and easier recovery. Of course, this all leads to the biggest question everyone has, right? We're talking about removing an entire organ. Is that okay? Is the gallbladder essential? Can you actually live a perfectly normal life without it? And the answer is a very clear and simple yes. Your body is amazing at adapting. Without the gallbladder to store the bile, your liver just lets it flow directly into your intestine as it's made. your digestive system figures it out, and you can live a completely normal, healthy life. So let's just quickly run through the key takeaways. Gallstones are hard deposits that form when your bile's chemistry is out of whack. A lot of the time they're silent, but they can cause really severe pain. Your diet is a huge risk factor. And remember those red flag symptoms like fever and jaundice? Those are urgent. But the most important thing, treatment works. And yes, you can live a perfectly normal life without a gallbladder. And really, if you take away just one thing from this whole explainer, let it be this. Don't ignore persistent abdominal pain. It's your body's way of telling you something is wrong. Getting it checked out early is the absolute best way to avoid serious problems down the road. And that kind of brings us to a final thought. We spent today talking about listening to your gut, quite literally. But it makes you wonder, doesn't it? What other silent signals might your body be sending you that are worth paying attention to? It's a great reminder to always stay tuned in to your own health.